Hi, Coach Peter Cummings here with Plan to Peak Health and Human Performance. I want to talk a little bit about this lifestyle therapy that I created and how it affects this issue of insulin resistance. In one of the previous talks, we talked a lot about what is insulin and how insulin resistance develops. And I would like to go over what the data, what the evidence shows about this program and our approach. And we're going to use the information that we've published in the peer-reviewed medical journal, the American Journal of Preventive Medicine. So we're gonna get into that a little bit and try and educate on how each of these components that we're recommending and how they work together. So this was the paper. It was called Lifestyle Therapy Targeting Hyperinsulinemia Normalizes Hyperglycemia, which is prediabetes and diabetes, and the surrogate markers of insulin resistance in a large free living population. So we had 536 people in this cohort, and what we did is we described the program and our approach and our methodology, and then we looked at what type of outcomes that were produced in this free living population. These people weren't locked up in a ward. These were people that we educated, supported, guided, and provided opportunities to coach them about their lifestyle, their nutrition, their fitness, and things like that. And we watched them over many years. In some cases, the least amount of time was 90 days, and in many cases it was as many as 6 or 7 years. So what we saw was the people that did have metabolic syndrome, and I talked about that in our last video. These are the people that have 3 of any of those 5 markers of insulin resistance, experienced a 42% reversal in that criteria. So we either removed 1, 2, 3, or all of their insulin resistant markers. So these are the clinical diagnoses that are used, as I mentioned in that video. So your waist is too big, your blood pressure is too high, you have high blood glucose, your HDL is too low, your trigs are too high. And we were able to reverse the diagnosis. So bringing them from whether it would be 5 down to under 3 or 3 under 3, or reversing them altogether, 42% of the people were able to reverse that diagnosis. And that triglyceride to HDL ratio, which I said in that video was so important to cardiovascular disease risk, there was a 36% decrease in that risk factor. And in blood pressure, which is one of the most common issues, a rising blood pressure in an insulin-resistant population, 60% of the population actually normalized their blood pressure, and most were getting off or reduced their medication. This was a significant improvement. So, as I mentioned, right, any 3 of 5 diagnostic codes are hard cutoffs in clinic, right? So, but unfortunately, a lot of times they're not brought up. I can't tell you how many people I've met whose fasting blood glucose is over 99, and their doctor still told them it was okay. Well, it's okay because they're not pre-diabetic at the level that needs to be medicated, and that's what that means. That's the interpretation of it's okay, it's good. It's not bad yet. It's not bad enough to prescribe you exercise. And if you have any of these, so low HDL, high trigs, high blood pressure, large waist circumference, and increasing blood glucose, you should be concerned about insulin resistance. Now, I use this thermometer here on the right because I think it's important to understand that these hard cutoffs can create a situation where your blood pressure is high, but not hypertensive, not by clinical diagnostic. It's your HDL is at 40, but it wasn't below 40, or your trigs were right at 149, so they weren't 150. or your waist circumference was, if you were a male, it's 39 and a half, right? So you think about it, it's like, well, wait a minute here. All of those numbers are right on cutoffs. Their blood glucose may have been 98. All of them right on cutoffs. These can't be optimal markers. But again, in traditional clinics, they're ignored because there are really no medications to treat the insulin resistance. But if you do have high blood pressure, they'll put you on blood pressure meds. But that doesn't fix the underlying cause, the insulin resistance. And I'm using this scale here on the right, this thermometer, to get you to think of a sliding scale of from going to from bad to good or good to bad, whichever way you want to look at it. And that's what comes in this concept of called the metabolic syndrome severity score. This scale was developed by some scientific researchers to show that insulin resistance develops on a spectrum. You just don't become insulin resistant overnight. You are either slowly developing it or you're slowly reversing it. And the other interesting thing about this metabolic syndrome severity score was in regard to the difference that they found between males and females and also different races. So the metabolic syndrome severity score actually takes that into account. And I have a graph coming up that'll show you the slight difference between the way males and females develop metabolic syndrome. But I like this tool because we can have conversations about progression of insulin resistance or reversal of insulin resistance without hard cutoffs. But people can see progress when they're making these changes to their lifestyle, and they can see this severity score decreasing and normalizing. It's highly motivating, much like watching your weight go down on a scale. So here's a chart I was telling you. So on the right here, you can see there's a red line and a blue line. And what happens when you put in a metabolic syndrome severity score, the numbers into the calculator, you'll see a negative number, which suggests lower insulin resistance. And this is that MSS Z score on the bottom axis. And then on the vertical axis, you'll see a probability of metabolic syndrome and/or type 2 diabetes, hyperglycemia. So as your score becomes negative, your probability becomes lower. And as it moves positive, you can see that it increases. But you'll see the red line as females and the blue line as males develop differently. So women, as they move towards a positive number, start to slowly increase in their insulin resistance. And their probability of and severity of their metabolic syndrome increases earlier. But with men, it happens very quickly. They may be okay for a while until they get near zero, but as soon as they start to develop a positive MSS score, you'll see that their odds and severity start to increase drastically. So advanced stages of insulin resistance is a loss of glycemic control. So in the earlier stage of insulin resistance, and I was talking about this in the other video regarding insulin resistance and how insulin is affecting your health. The earlier stages are the hypertension, the weight gain, the changes in your HDL and triglycerides. It's when your pancreas can no longer produce insulin at a high level, because that's the way the insulin resistance was developing. The insulin was produced at higher and higher levels to try and overcome your body's resistance to the insulin message. But then once that pancreas has reached peak insulin production levels and starts to decrease because it's becoming burned out, this is when we start to lose control of our glucose. And even in our pre-diabetic population here, you can see that 35% of our pre-diabetics, now this is an advanced stage insulin resistance, 35% normalized their blood glucose. Excuse me. Even more interesting, only 2% progressed to type 2 diabetes. Now, the reason that's important is year after year, we find that 11% of all pre-diabetics progress to type 2 diabetes. And type 2 diabetes is a major driver of cardiovascular disease, blindness, kidney failure, amputations. This is not a place you want to be. And we reduced it from 11% to actually 1.69% if you read our paper. In our type 2 diabetics, again, even more insulin resistant, these people, 64% reduced their hemoglobin A1C, which is a 90-day marker of glucose, below diabetic cutoffs. So according to their hemoglobin A1C, almost 50% of our type 2 diabetics no longer met that criteria for diabetes, and many achieved drug-free remission, meaning that they normalized their blood sugars while we were taking them off medications. This is how powerful the advice and the guidance that we give you if you take it and you adopt it. Cardiorespiratory fitness. As I mentioned in that previous video, loss of cardiorespiratory fitness is one of the earliest warning signs that you're developing insulin resistance. So you want to be fitter. I didn't mention it in the video, but I'll mention it here. The very best predictor of mortality and morbidity is actually your cardiorespiratory fitness. So improving your cardiorespiratory fitness decreases your odds of all chronic disease and of death. And what we saw was a significant improvement in cardiorespiratory fitness across all of our cohorts, near 30% improvement in their cardiorespiratory fitness. And this level of fitness was maintained, like I said, in many cases, 3, 4, 5, 6, 7 years, as long as we've had data on the patients. So how does our program work? Well, there's a lot to learn, right? I understand that there's a lot coming at you in these videos, in these lessons, in the handouts that we give you. There's a lot of changes that you have to make. You have ingrained habits that need to be addressed. But you need to understand things first. So in the initial phase, in these first 3 months, reading these articles, watching these videos, and really interacting with your coaches about how to make better choices across the board, how to make sure that you have the minimal amount of exercise to try and improve your fitness, how to make sure that you can change your diet just a little bit here, a recipe per week to work into your new recipe list, to try and decrease the insulin load over time. This first 3 months is challenging, but once you start to develop these habits and you get past this first 3 months, you start to realize that you have developed and you are refining these new long-term habits. They become more normalized. They become second habit. And then your exercise prescription, it needs to progress over time. That's one of the things with exercise is doing a little is very helpful until it becomes a maintenance dose. Then you need a little bit of progression. It doesn't necessarily mean more time to invest. It may mean just increasing your intensity a little bit or finding an exercise or activity that's a little bit more intense than the one you were using. So this progression needs to take place if you really want to reach the highest levels of health. And we continue to work on your nutrition strategy throughout this entire time period, trying to get you to eat more whole food, real food. And this is what we're working for each and every week. We keep the goals simple, the changes straightforward. And the reason we can do that is because we have these outcomes. We know that each one of these changes is a building block to an overall system. It's a whole new lifestyle that you're creating one habit at a time. So the key implications, if you follow these recommendations, is you will see, like the 536 people that we have in this paper that we've published, a reduction in prediabetes, a reduction in type 2 diabetes, a reduction in cardiovascular risk. You will be able to start reducing medications or avoiding them altogether. And I have to tell you that while I understand that there's a cost, the cost of being sick is much higher. This is a very cost-effective way to live and educate yourself and prepare yourself for a long, happy, healthy life. It's important to understand this concept of pleiotropic improvements. So each of these changes that we're going to ask you to make to your diet, to your exercise, will have an effect on multiple components. So as you eat better, it makes it more conducive for your cardiorespiratory fitness to improve. I know that's not exercise, may not make sense, but it works. By reducing inflammation, you make it easier to exercise. By sleeping better, you make it easier to exercise. By exercising, you make it easier to sleep. So each of these components that you're working on will affect these markers of insulin resistance, the metabolic syndrome severity, will change disease burden, and improve your cardiorespiratory fitness as they work together synergistically. So in conclusion, the evidence is clear. We've been doing this for years. We worked hard at developing the resources, the guides. We're going to continue to do these videos to make it convenient for you to share this message with people that need it. You need to help people identify this downward spiral sooner rather than later. It's easier to correct these things at earlier phases. It's more difficult, but as we suggested, even with type 2 diabetes, it can be put in to remission, drug-free remission. The problem is, as we go through this progressive disease state, we are spending time damaging ourselves. So avoiding it altogether is probably the best strategy, but unfortunately, my experience tells me that people are motivated to make these changes at different times for different reasons. For some people, it may be the birth of a first child and realization that they're now a parent and they need to live a long, happy life. For others, it's being a grandparent and realizing, wow, I can't even take care of or play with my grandchild the way I want to. For others, it's my doctor's talking to me about medication for the first time. For others, it's, I'll take oral medication, but now my doctor's talking to me about needles. Whatever the case may be, everyone is going to find their way to a motivating reason to start taking better care of themselves. And if you have people in your life that you feel need to make changes, the most important thing to help them find is their motivation, not tell them that they have to make change. No one responds well to that. But to have an answer for them when they find that motivation, or to help them through conversation find that motivation, is the secret to helping people. Because then when they want that help, you'll know where to guide them. We have a comprehensive approach. These things work synergistically, and they affect all aspects of your health, your quality of life, and your lifestyle. So take heart. If you've just started with us, you're going to see great improvements. If there's people that you would like to help, try to help them find the motivating factor within themselves of why they want to be healthy, and then offer them the opportunity to discuss with us how to fix that. Thank you very much.